We will now have a short Q&A session and invite all of our speakers back up to the stage. During the Q&A session, for anyone in the audience who has a question, there is a microphone in the center aisle for you to use.
Thank you very much for wonderful presentations. So I'm a practicing neurosurgeon, so I'm learning about spirituality, actually. So in my everyday work, I see the pineal gland on CAT scans every day. And I was wondering about what do you think is the function of the brain sand? Is that the place for the interface between spirit and the physical realm, for instance?
I think that well, there's some evidence that the pineal gland can be an interface with regard to the spiritual dimension, but I would think that I've done a research program about spiritual state and mystical state. I've done that with Carmelite nuns in the past, and we were seeing also activation in other regions. So it's possible that, including the temporal lobe, the right temporal lobe especially. So I would think that it's possible that you have a complex neural circuit that is involved in spiritual states, and that you have a number of brain regions mediating various aspects of the spiritual states, and this could include the pineal gland.
Hi, my name's Joe Eyler. I've got a question. I'm of the Christian faith. I believe in the Bible, and I've been listening to a lot of things about reincarnation. How do I juxtapose my belief in the Bible with reincarnation?
Acreditar na Bíblia e em reencarnação? Tá meio fora do tema, né? Mas vamos. Podemos ir?
Can we start?
A Bíblia, ela contém
The Bible
vários
contains
trechos
a number
que são
of different
indicativos
selections
da
that indicate in
Então,
reincarnation.
nós vamos encontrar nela
We're
mesma,
going
não
to
precisa
find
nem
within it, we don't
buscar,
even need
talvez,
to
em
look
outras fontes.
in other sources.
Vamos encontrar
We're going to find
Jesus conversando com os
Jesus
seus
talking
apóstolos
with his apostles,
e ele falando para eles
and
sobre a
he's
questão
telling
da vida
them
do
about
profeta
the
Elias.
matter of the prophet Elias.
Jesus pergunta: "Que dizem
And
o
Jesus
povo que eu
asks,
sou?"
what do people say that I am?
Apóstolo diz:
And the
que é o
apostles
filho de
answer,
Deus, que é um
the
profeta,
Son of
Elias,
God,
que
your
é
prophet,
várias
Elias,
respostas diferentes.
a number of different
Aí
answers.
diz: "Mas
Then
Senhor,
one says,
disseram que
but Lord, they
Elias
say
teria que
that
vir
Elias
antes do Filho de Deus."
had to
Jesus
come
diz:
before the Son of
"Em
God. And
verdade
Jesus
eu vos
says,
digo que
and
Elias
in
já
truth, I
veio
tell you that
e o povo
Elias
não
has
reconheceu."
come, and
E
the
era
people did
de
not
João
recognize him.
Batista que ele estava
And it was
falando.
John
Ou seja,
Baptist, the
Jesus
Baptist he
ali
was talking
confirma
about. That is,
que João
Jesus
Batista,
confirms
a
that John the
personalidade de João
Baptist
Batista,
the personality of John the Baptist was a reincarnation of the individuality of the prophet Elias. Only one of them, for not to go on for the very long answer, I can cite other ones for you too, after in the interval. So the Bible itself contains a number of indicators of reincarnation. Now, let us consider only that Jesus put there the principles of reincarnation for the Western humanity, which would be doubled in the future with progress of religion, and today it's very well explained by spiritual knowledge or Spiritist knowledge.
I will ask a question. Dr. Beauregard, we know that it's very difficult to publish scientific papers, especially in the field of parapsychology, consciousness studies. I'd like you to comment about that.
Yes. Yeah, if you want to publish in very highly ranked journals in various fields and mainstream science, yes, it's very difficult to publish because like I was talking about in my presentation this morning, most people in these fields still believe in the old materialist framework, and the assumptions I was talking about have become like dogmas, an ideology. So if you do not adhere to this ideology, if you want to present experimental findings, questioning, challenging this ideology, there's censorship still today, because of that. Yeah. And also because of the fact that if you dare going out and say that you do not agree with the dominant ideology, you may risk to experience problems professionally. So you may lose grants, you may not get your tenure. You know there are all sorts of problems, and so I think it's another reason why.
I've run across, Judy Catt, some information recently about the effects of fluoride and wireless technologies on melatonin production. And I was wondering if anyone is doing any research on some of how modern pollutants are affecting spirituality.
Could you repeat the question?
That there are substances and energies that are affecting melatonin production in probably the pineal gland. I'd heard recently that fluoridation of water is attracted to the calcium in the pineal gland, and that perhaps that's the mechanism for reducing intelligence that they've been finding. But also wireless technologies, which disrupt sleep, have been shown to affect the melatonin cycle. So I just was wondering if anyone's doing research on how modern life is affecting spirituality.
Okay, if this can affect spirituality, we don't have this answer, in fact. But I think that, as Dr. Beauregard said, we have a complex circuit that includes the pineal gland, but includes other mechanisms to feel the spiritual sense. So I don't believe that we can have this disconnection with the spiritual world. But I think we need further studies to address this issue.
My question is for Dr. Beauregard. You talked about the psyche influencing some mechanisms, pathologic mechanisms, for example, in Alzheimer's disease. Mm-hmm. Is there any studies or any projects trying to address the positive mechanism in changing psyche, in changing thoughts, behavior, to get Alzheimer better?
To my knowledge, unfortunately, not yet, because the focus is on the negative stuff, pathology. way too much because, you know, we could do exactly the reverse and study human potential and how we... In neuroscience, it's starting a bit with this concept of neuroplasticity. So now you have studies showing that the practice of meditation can lead to functional and structural changes in the brain. But in the sense you're alluding to, no, not yet to my knowledge. Hopefully it will come. But the problem, as you know, it's always to get the funding. You need the funding to do these studies.
Thank you. I have a second question to Dr. Oliveira. I know you are an anesthesiologist, and I'd like if you could elaborate very briefly on the mind, the spirit during the anesthesia procedure. Como nós sabemos que o senhor é um anestesiologista, gostaria que pudesse elaborar brevemente o estado do espírito durante o período da anestesia.
Neste momento,
At this moment,
o ser humano submete
in
a uma
which
anestesia
the
geral,
human being submits to general anesthesia,
comparar
we can
semelhança à
compare
informação que
the similarity of the information, the spiritual information that we have of a status of coma.
o
That is,
espírito está desprendido
the
do corpo
spirit
físico
is
e
disconnected
a
from the
sua
physical body,
situação do outro lado
and its
vai
situation on the other side
grau
will
de evolução
depend
moral que ele se
on the
apresente.
grade of moral evolution that it has.
Nós não temos ainda
We don't have
evidências
still
nem
evidence,
médicas nem
the
espiritual
medical nor spiritual
para
evidence,
dizer que
to
o
say
espírito vai estar em tal
that this spirit is going to be in such and such a place.
Falar isso seria
To
leviandade
say
nossa.
this would be
Procuramos ter uma
incorrect
ideia
for
por
us,
analogia.
but we try to get an idea through
O
analogy,
estado de coma, o
because
espírito
the
está
status of a
desligado
coma
e sem
where the
consciência
spirit
naquele momento,
is
em
not
alguns
connected to the
casos,
body
em
and does
alguns
not have
casos,
consciousness in most cases.
a mesma coisa, e como a anestesia
The
promove
same
uma
thing can happen
inconsciência temporária,
because
o espírito
anesthesia
ele
promotes
pode
temporary
estar na sala de
unconsciousness.
cirurgia,
The spirit can be in the operating room,
observando
one
tudo que
possibility,
está acontecendo.
observing everything that's
Ele
happening.
também pode estar
It
em
could
alguma
also be
instituição
in
de
some
repouso ou de
institution
amparo, sendo
of
levado pelos seus
support
familiares ou
without
protetores.
being
Como ele
taken
também pode
by
estar em
its
alguma
protectors
situação
or
de
family members,
perturbação.
or it could be in a perturbation
Vai
situation.
depender do
It's
nível
going
de
to
evolução
depend on the
espiritual.
level of
Nós não
spiritual
devemos
evolution of
esquecer
the
que
person, but we should not
também
forget
as drogas
that
que se
also
usam durante a
the
anestesia,
drugs that are used during
elas vão
anesthesia
proporcionar
are going
efeito
to
no
cause
perispírito,
effects
ficar impregnado no
in
perispírito
they're going to become
daquele-
impregnated in the
daquele espírito.
perispirit.
No livro Obreiros da
There's
Vida Eterna,
been
tem o caso da
workers of eternal
desencarnação
life have
de
shown
Jerônimo,
the case
e
of
nós temos ali
the death of Geronimo.
caso de eutanásia
We have a case of
relatado
euthanasia
pelo mundo espiritual,
told by
onde
the
a
spiritual
injeção
world,
de substâncias
in which the injection
hipnóticas em altas
of
doses,
hypnotic
acreditamos
substances
que
in
pela
high
época
doses. We
utilizada
believe that at the
deve ter sido
time
tiopental
that this
sódico,
was
que
used,
existia naquela
pentium
época,
sodium
promoveu
pentothal,
e
was
aquela
used to
droga
promote
ficou impregnada no
that
corpo espiritual
drug
de Jerônimo,
became
dificultando o seu
impregnated
processo
in Geronimo's
liberatório.
perispirit and was not
Sônia,
able
mais
to get
por
free.
analogia
So
do
by
que por
more
informações
analogy
diretas,
than
deduzimos
direct
que
information,
a
we
situação
deduct,
do espírito
assume that the situation of the
durante a
spirit
anestesia geral
during
vai
general
depender
anesthesia is
do
going to
quanto
depend
ele já acumulou
on
em
the
amor e sabedoria
how much the
que
person
nós
has already
vimos
accumulated in love
através
and
da
wisdom
sua
that we
vida.
saw here during his life.
Thank you for your presentations. Were very nice. It's a very big pleasure to be here. I'd like to know about out-bar experience from Dr. Mario, because you have research nuns, Carmelites nuns, and also meditators, beginners, and with experience. Where would you go to look for evidence for out-of-body experience with mystical meditations, with religious people, or maybe in anesthesian procedures or near-death experience? Where did you go?
The problem with the brain imaging techniques that I've used in the past is that when you do that, you're simply measuring correlation. So you see something that is changing in the brain, and this is associated to a change in the mental state. But there's no causality involved. So it's not because you see different colors, you know, in your scans that you can say that this is the change that you're seeing is causing the change in the experience of the people you're investigating. So if you want to go further when you study, for instance, transcendent experience, stuff like that, I would, and I already devised a project with people suffering from cardiac arrest, and because there's a transcendental component. There's not only the out-of-body perception experience, which is perceptual, but there are also other aspects, the transcendental aspects or spiritual aspects. And if you're measuring what's happening or you're presenting, for instance, hidden targets in the surgery room, this can be done. And some people are trying to do this right now around the world. It can be done to this type of surgery, for instance, to remove or to change the aorta. You will decrease the body temperature of the patients. It's hypothermia. You will stop the heart and the blood circulation, usually for 15, 20 minutes. So in that kind of state, it's possible to do experiments. For instance, place hidden targets, visual targets, in the surgery room. And so that's one possibility to verify that these people can, you know, see things or, yeah. But it's not very easy to do because I've started a project like that, and I'm participating to a project called the AWARE project with Sam Parnia in the United Kingdom. The problem is that when the people have near-death experience during cardiac arrest or induced by other factors, they are fascinated by their own physical body, lying down, for instance, on a gurney, and they are not thinking about, because there's a great expansion of state of consciousness, and in that state of consciousness, they don't care anymore about looking or you know, seeking for objects without any significance, you know, in the surgery room. They don't. That's not. So it's a difficult challenge from an experimental point of view, but that's what I would do to push further this line of research. Thank you.
So the patients that are going to be cooled down and have induced cardiac arrest.
Yes.
They are elective surgery patients. They could be informed before. About the project.
Yes, but I started a project like that a few years ago in Montreal, actually. But to warn the patients in advance would be considered a bias. So I didn't warn the patients in advance, yeah. Unfortunately, we started the project, but after a few days, the project was rejected by the hospital. And so it was not possible to continue for ideological reasons, again, so. So I'm looking for new partners to do this project. Perhaps, pardon me? The AWARE project in UK? No, they don't. No, because that's the problem. They are putting hidden geometric symbols, for instance, in various places in the surgery room, but the experiencers are not interested. They are more fascinated by recognizing themselves, lying their own physical body, and they are seeing very often the light, even in the surgery room, and they are tempted to follow the light in the tunnel, and so it's quite tricky to do something like that.
My question to Dr. Mario. As we have a wave electricity, we are lights of the world, everything. Do you believe on the possibility of like a premeditated, intentional from someone use their energy to make you and someone else sick, like to prejudicate someone else?
Oh, I'm not sure I understand.
It's, you know, when you enter an environment and you just feel sick and you don't know why, so you feel like the energy of that space is not good.
Yes.
So you believe that people can do that to others, like use their power negatively to harm someone else?
Personally, yeah, I am not sure it's been investigated scientifically yet, but yes, I'm certainly open to this possibility. Yeah.
Thank you.
I'm sorry, I have another question. Because I read your book, Dr. Mario, and I was very impressed, and I sent you a mail, but I think it was wrong mail address. But what I described in that mail was the question is, where in the brain is the self? Okay, the self. And my experience is, why I ask you this, is that my personal experience is that operating patients in an awake state, you can map the brain, and then, for instance, you ask the patient to move the thumb, okay? And then in this setting, the patient was asked to move the thumb, and I asked the nurse, what happened? And the patient said, I moved my thumb. Okay, that's great. And then I stimulated the region of the cortex where the thumb is controlled, and I stimulated the region, and I could see that the thumb was moving. And I asked the patient, what happened? And the patient said, the doctor moved my thumb.
Yes, exactly.
So where is that sense of self-controlled?
Well, in my view, the self, the mind, psyche, consciousness, these are concepts, and they refer to phenomena that are non-physical. So it's foolish to try to localize the self within the brain or the body, because it's much more than that. So it's associated with the brain and the body under normal circumstances, but it's much more than that. So because it's non-physical. Yeah.
Are there any other questions from the audience for our speakers? Okay, very good. We will now take a lunch break on... Oh, please, go ahead.
Maybe because there are a lot of Brazilians here, and I'm going for this kind of experience. And maybe I have a particular state in Brazil that most of people in Brazil have some experience. Maybe they are not so impressed to look for his body and to his body in these procedures as anesthesia and cardiac surgery or cardiac arrest. Do you think that this is a possibility to look for?
Yeah, but what would be different than others have attempted? What would be different in Brazil?
I think because actually most of people here, for instance, already have this experience of out-of-body experience. And then if he is in cardiac surgery, he probably won't stay there looking for, wow, that's new for me. Yeah, maybe the people that work with mediumship and things like that could be a arm for a project that would be easier to look for this evidence.
So it would be possible to include, for instance, mediums in this project to help the people out of body during the NDE, perhaps
to explain things,
to guide them, or to and then perhaps you would have more chance to be successful. Yeah, it's a very interesting idea. Yeah.
Look for. Okay, thank you again.
Okay, so we will now take a lunch break.